I just have a small slide presentation about Appa. I want to start by thanking everyone who's been so wonderful in the encomiums of praise, and believe me, to hear people like Professor Vittal and Professor Thanikathiram and Justice Rajendran speak about him, Appa will be very, very happy. I also want to say that we really mean this as a family, that we, as my sister rightly said, this meeting is not about mourning, it's to celebrate a really good man's life. And I also want to say that every single person who's come into this room and who's going out will go with Appa's blessings, and you will see it, you will understand it in the next 5 minutes of my slide presentation. About 50 years ago, when my father was 17, his father died. And his father, like my own father, was so popular with his students that a gentleman told me this about 10 years ago. He was then 80 plus, he's now 90 plus. And this gentleman said, even when my own father died, I didn't hug him and roll. But when your grandfather died, I was having a bath, I left that, ran and hugged him and rolled with his corpse on the floor. You might think it's a story, but it's true. The gentleman is then 80, he's now 90, and he's sitting in the first row here. Dr. Kadri sir, we just want to thank you from my family for what you mean for several generations. And he has continued his friendship over the last 67, 60 years or 65 years. He's been close to my father as well, and mashallah, he continues to be very well. I'd like to quickly run through Daddy's life by starting. Everybody knows about the medical side of Appa. I'm not even here to talk about the family side, but just some things that I believe that I have learned in his life. As a very famous educationist called H.G. Balakrishna Joshi, he was likened to Sarvapalli Radhakrishnan, Lal Bahadur Shastri, very, very great educationist. He was the head of Hindu Theosophical High School, and he recognized Appa, and this is the first gold medal that my father had in 1948. He's a gentleman. He said, this boy is a real gentleman. And I don't know whether this is the impact that teachers have on us. Perhaps because H.G. Balakrishna Joshi told him that right until 12th October 2014 when he passed away, J.R.S. was the perfect gentleman. This was given for the way he conducted himself towards others, and we have learned how to conduct ourselves with the whole world. It's a beautiful Tirukkural. Appa Brahmapurucha used to enjoy Valdavam. And a beautiful one that starts by saying, Kaimar Venda Mari Mattu. The clouds, anybody living in Chennai in the last few days, you'll understand how the clouds pour the rain. The clouds, Tiruvalluvar says, give the rains to the parched soil without expecting anything in return. And so also will a good man of the earth do unto his fellow beings without expecting anything at all in return. And I really think that's one thing that Appa did. I even mentioned recently at one of the meetings in Madras Medical College that he went out of the way to be extremely kind to Professor Thanikathiram was saying he has seen him struggling in the so-called quagmire of medical service. My brother and I early on saw all this quagmire of medical service and decided that we would have nothing, excuse me, there were a lot of people who were in service, nothing to do with medical service because of the trouble that Appa went through. And yet he went out of the way to be especially nice to the daughter, the son, etc., of even people who were particularly nasty to him. And I've learned that from him, and he's been like the clouds. One of my favorite poets is Ajmer Shishti Saab or Khwaja Saab, and he says, every man should learn from the river, how the river keeps giving to the soil as it moves, and finally, having a little bit more water with itself, gives even back to the ocean. And I felt Appa doing that right through in every aspect of his life. In his mind, one of the biggest that he ever made, awards that he ever made, he had 20, was the Eminent Medical Teacher Award. Many people, somebody was telling me that people get happy that I posted, and 19,000 people had seen it, and a few thousand had liked it. And that's the kind of impact. There's a change, and we have to speak in terms of technological scales, and that's the kind of impact that Appa made. I also think that the Lifetime Achievement Award as a clinician, which Appa got, as many people said here, he was the ultimate compassionate clinician, and you will not believe, even until a month or two ago, when he used to send patients to me to operate, he used to write there, this patient can't afford no fancy instruments, and he used to put one exclamation mark. We surgeons, we'll put staplers, this, that. He was thinking in terms of the common average man, and that's the kind of doctors that we don't have these days, unfortunately. And this is another thing, my father really believed in research when, due to politics in medical service. He got shunted to the Central Research Cell. He made use of it and brought out a large number of papers, and he really believed in research. Even recently, I actually brought something even for the service in my bag. It is the last, it's okay. Every time I told him, we did some wonderful service, we took out so much of the kidney and the stomach and this and that, my father would say, you first publish it and then come back to me. Don't talk to me. He really believed in publication, and he wanted this to spread among the youngsters in India. Actually, this is the last publication that we made in this journal, so it's the Journal of Endocrine Surgery. And I got this and came to show it to him, but he had breathed his last by then. I used to hear Appa saying this. He used to ring me and say, hey, my paiyan Vice Chancellor laita. I would not know who is the Vice Chancellor, because everybody is his paiyan. Vice Chancellor. A few years later, he rang me a few months ago and said, my paiyan Vice Chancellor laita. Who is this? Shantara. I mean, both of them are supposed to speak today, both the Vice Chancellors, but both of them got held up and they couldn't make it. Similarly, some had gone to some wedding, and as I was going, he pulled my hand back and said, it is my paiyan parra, ketu pola. It was actually Sirgari Sivachidambaram, Sirgari's son. He's the number paiyan, because he was a student too. So, some other program he rang me and said, Namma ponnu nalla, Pulla is for the girls he used to use. He said, Namma Pulla nalla anchor panna. Then I found that Dr. Sudha Seshan was anchoring some Tamil Nadu MGR Medical University program. He's a man who believed that every student of his was Namma Paiyan, Namma Pilla. So I used to tell him, Yenda Paiyan pa, Yenda Pilla pa. That kind of impact that people did for him. As I mentioned, he also very, very strongly believed in research, and he used to drive us on right to his last day. He used to, only thing that brought a smile on his face, not some wonderful operation that I wrote and it'll come out in some newspaper, he wouldn't bother. But if I got a journal publication, even one small publication, he would really be enjoined by that. And Dr. Kumaraswamy here knows how much he did. They say, a good teacher makes you talk, but a great teacher makes you walk the talk. And I found, for example, that when I posted on Facebook, I had people writing to me from virtually every country saying he'd been such a huge inspiration. Many people make records, so many surgeries, so many things. Daddy's major record that he gave in Madras Medical College is that he gave the record pass mark. Those days, especially in medicine, only 42% used to be the pass. Sir, I'm sure all of you know this. One day, one particular person who we also rang up and invited for this meeting, he was supposed to be the examiner, and he was notorious for giving 30 to 40%. He was stabbed by his driver, and he could not attend he could not be the examiner. There was a big party in the MMC hostel because my father was nominated as examiner, and he gave a record 96%. And after that, all the guys got together, used influence from the HM level, from the CM level, and made sure he was the examiner every time because he was just passing people left and right. And I used to ask him, Daddy, I heard this, that you passed many people. I was a kid, and he said, Pavanda, the person who pass panite, they have to go and sit down and work day in it. Pass panite, fail panite. He had that kind of a very wide, global kind of feeling for people. These days, every man bothers only about I, me, and mine. And my father, in this world, he had a big feeling, let everybody pass, let everyone get good jobs, let everyone go on and come up in life. And that, I think, is a very sustaining legacy of his. Dr. Kumaraswamy mentioned, I remember 1993, my mother and father had a big argument. My mother saying, and I had just come back from UK, and my father was explaining patiently to my mother, Setu, you listen to me, nothing will happen. And I remember a few years after that, my father to the breakfast table brought a cutting of Princess Diana to show that HIV doesn't spread by contact. She had kissed some HIV positive people in the other cheek. So she brought it. Typical mother response. She was worried that this terrible disease called AIDS, people thought people just died like flies, and here was her son, apple of her eye, and her husband was saying, go on and operate. He was the man who taught me, like Dr. Kumaraswamy said, how you can touch these people, you can look after them. And I will tell you two miracles that happened in the last week. I'll tell you about that. There is no continuing medical education program anywhere without Appa teaching. He used to actually tell people, he used to actually mimic the murmurs, make sounds and say, I used to ask him, why is that? He says, look, it's not about anything else. That boy must be able to recognize that sound. and then only he will do the patient justice, and he really believed in that. As I said, this is many of the lifetime achievement awards that he got for HIV medicine. I'm going to tell you a quick story about the last HIV patient. Appa didn't even want the hospital to stop functioning for more than a day. So we had cremated him on Monday, and on Tuesday I operated upon one of his patients who was waiting for me to operate upon. He was a patient with HIV who also had cancer of the rectum. We did a very, very major surgery on him, and it was a bad case. So by Tuesday night, I was totally exhausted. We'd operated upon this guy. We packed it, and I said, we'll come back in the morning and we'll take out the packs. My father doesn't like me to wake up. His policy is padu alladu padi. He wants me to sleep. He only wanted me to eat and sleep. I would tell him, Daddy, I did this often. Sapya, the only thing. I did this, Tungniya. I'm going as a RCS examiner, Professor Vittal has gone. Tungniya, Sapya, Tungniya. Mati, my father used to ask. So this patient, I operated upon him on Tuesday. Daddy died on, we cremated Daddy on Monday. And on Tuesday night, at 1:30, 1:45, my father was waking me up and saying, Indra, prepare Samuel, prepare. His name is Samuel, by the way. And I was wondering, my daddy never wakes me up. He always makes me sleep, through my mists of sleep. Then a little bit more than, oh gosh, daddy's gone, And then I woke up, there was nobody, only Kala was sleeping next to me. So he mentioned, wake up Samuel. I said, Kala, I'm worried about, she'll corroborate, and my patient would corroborate as well. I rang the ICU, and this guy's BP was actually going down at that point of time. So I rushed back. I was very tired. I need to drive me to the ICU. Both of us stayed with the patient. We pumped in a little blood. We took him back into theatre at 5:45. We operated upon him, and he walked out within 3-4 days' time. And before walking out, he told me that 3 years ago, when he came down with very bad HIV, bronchopneumonia, Appa had treated him for 5-6 days in the ICU. And he told him, it seems you used the money for your drugs. And he said, I actually didn't even know that he was so linked to Appa. So somebody said, many of you said that they stay back as Siddhas, and we actually saw that happening in our hospital in the last week. And that patient owes his life to Appa like thousands of other patients. Indeed, now we've operated upon, Dr. Kumaraswamy knows, nearly 1,700 or so patients with HIV we've been operating upon, all because of Appa. And like my father's legacy, as a policy, we do not charge any surgical fees for this, for any of these HIV positive patients, because I really believe, Appa told me, he said, when you go, what you leave behind, the number of people who think about you, and people who just say maybe amass wealth or build buildings, how many people are thinking of them? But I know that like Samuel, millions of, certainly lakhs of people are thinking of Appa, and I know that thousands and thousands of HIV positive patients are thinking of Appa. This is another interesting thing about Appa. He believed in alternative medicine. He didn't think that alternative medicine is crap. He believed in Unani. He believed that Unani practitioners and Siddha practitioners are good. And some years later, when I was reading the Tirumandaram, my father used to sit with me and say, Tirumoolar enna solraru about this, Tirumoolar enna solraru about that. He really believed that there were many ways to cure patients. Today I believe that allopathy is just one of 1,000 ways to cure a patient, and if somebody has a better way, I will quit medicine, or I will not do, you take the knife up. If somebody picks up a new drug, and that's what Appa taught us, that there are many, many ways of treating patients. We have learned one way, and let us not be too proud that this is the only way. This is of course Appa getting us married, and this is us getting Appa married for his the 88th birthday and last wonderful memory. I want to end by saying, about 2 weeks ago, my brother, my son and Appa and I, 4 of us were having breakfast, and we were just discussing, and Appa was saying, we were discussing Tirukural, and Appa actually said this Tirukural, the last Tirukural he said, Inna Seidari Orukkan, Avar Nana Nannayam Seidu Vidal. He actually said the whole thing. And Ani was asking me, what is that, Daddy? And I was breaking it up for him to say that, for those of you who don't follow it, the right way to get back at the person who's done bad for you is to do so much good for him that he feels ashamed. Our Nana Nannayam Seidu Vidal. And I think that was one of the enduring lessons that Appa left behind. The thing about, and this legacy is what Daddy wanted. He wanted the legacy of medicine to continue. First Tata, whom people like Dr. Kadari really hero worshipped, and Appa, myself and son, and I hope that this, I want my last slide to say that this world has only eyes for freakisms, sensationalism. Nobody cares if a dog bites a man, but if a man bites a dog, it will come to the front page of Times of India, or it will come to the front page of some paper. Everybody wants sensationalism. Everybody wants freakism. You celebrate greatness. Somebody built a 30-story house. Somebody, operated for 96 hours. Daddy didn't do any big freaky things like that. He was not just greatness, but he was a combination of goodness, a good husband, a good father. He was a wonderful son. He was a wonderful father, doting grandfather. I'm sure many people are up to there. Everybody is a good father, everybody is a fantastic grandfather. Even the biggest villain in the world will be a fantastic grandfather. But how many people will care for HIV positive patients? How many people will willingly expose their son to the risk of operating on HIV positive patients? How many people will do thousands and thousands of patients free? But that way, I think, today we are all coming together to celebrate a man's goodness, and that goodness and greatness can come together. Once more, thanks from all of us for having come today, for having filled this hall, and for taking back the blessings of a life truly well led.